So I've always really liked working with my hands. I've kind of liked artistic things. I've also been very mathematically oriented and like just the precision. And I think surgery is a way to use your hands in a creative way and treat patients and practice medicine. Seeing the patients in clinic after operating on them and seeing them do so well, it's always just rewarding and keeps me going. So I hope to provide a very collaborative and educational experience for them. I want them to be educated on the disease process and the treatment options they have, and just have a really open communication with them and their understanding of the process and what we'll be doing and coming up with a plan for them. I always enjoy being in the operating room and performing the surgeries, but more than that is just seeing the patients and their families afterwards and how appreciative and grateful they are that you really provided them with something that changed their life for the better, and how well they do post-operatively when they come to see you. I'm really artistic. I like any kind of DIY project. Sometimes I feel like I'm HGTV, but I'm not. Anything to like fix up or paint. I usually have paint on my scrubs or my hands when you see me. I am really good at finding 4-leaf clovers, if that's a skill.